This episode of the Predictable Revenue Podcast is brought to you by SDR Pods. Learn how we can build you a fully equipped sales development team to execute on personalized multi-channel prospecting and book you more meetings at the link below. It's difficult to sell into a highly regulated industry. Like my guest, the healthcare industry, regulations are constantly changing and your customers expect you to adjust and come out ahead of these changes at every turn. But if you don't have a good strategy for keeping up to date on everything going on in your industry, you're never going to build the trust you need with your prospects. I'm your host, Sarah Hicks, and today on the Predictable Revenue Podcast, I'm going to be chatting to an expert about selling into the ever-changing, highly regulated industry of healthcare. He is currently the National Sales Director for Nona Scientific. Nona Scientific is a Florida-based high-complexity diagnostics laboratory that specializes in urine drug screening and molecular testing. He's a national award-winning sales professional with over a decade of healthcare and laboratory experience in both sales and executive leadership. He has experience starting, building, and managing businesses across multiple industries. McKellar, welcome to the Predictable Revenue Podcast.
Sarah, thanks for having me. I look forward to speaking with you. And once again, it's a pleasure.
Yeah, I'm really excited. Mac, give our listeners a little background on yourself.
Yeah, so I live here locally just outside of Orlando, Florida, and I have been with Nona Scientific now for a little bit over a year. And Nona Scientific was founded about 2 years ago. And like you said, it's a diagnostics laboratory. And so we started off just doing the urine drug screening. And then as COVID evolved and became the pandemic it is today, we got into the molecular testing, including COVID. And it's something that I've kind of worked my whole career up to this point to really join a company from the ground floor, to grow a sales team, to help operationally. And so it's been a long time coming, but it's been a fun ride. And so I'm happy to kind of share my experience in this crazy industry that we're in.
Awesome. So as far as selling with Nona goes, what are the different regulations that you have to worry about?
Yeah, it'd probably be easier to start with a list of things that aren't regulated in
Sure.
my day-to-day. No, but it's a highly regulated industry that we're in. So from a laboratory standpoint, we have our CLIA certifications. And so it's a lot of regulations within the lab on quality control and the testing processes that go in every day to make sure that you're sending out accurate reporting and the machine and equipment's running effectively. With COVID, we have CDC guidelines that we have to follow. We have reporting guidelines for health department of what we have to report on the patients and when we're reporting. So we report out every single day. From a sales standpoint, there's a couple of things that we have to deal with. From a management standpoint, we have to follow a law that's called ECRA, and came out in like October of 2018, and it's all based on how laboratory industries reimburse sales reps and pay them. And, there's no commission now. And so it makes it very interesting on incentivizing sales reps, but still being ECRA compliant. And then when we're out in the field on a daily basis, we have to deal with the Stark Law. And so Stark Law is the anti-kickback law, right? So no pay for play or giving doctors monetary, money or gifts or things like that. And so across the board, there's really no aspect of our business that isn't regulated.
Awesome. So as we mentioned, that makes it a difficult job. There's so much that you've got to keep track of kind of throughout your selling process. You've got to understand all these little peripheral things that are going on for every customer or prospect that you're talking to. So how would the reps at your company do all of this research to gather all the information on all the regulations?
Yeah, so that really falls back on to us at a management and executive level. And so we do numerous things. Number one, we have in-house counsel, right? And so we have a fantastic attorney that works for us with a whole team, and we run everything through her to make sure that it's, either black or white, no gray area. We work with consultants, so a laboratory consultant. We work with a medical doctor consultant. We have a medical director. we follow, we go to a lot of different trade shows, and they'll have different people speak on changes within the industry. And so being as proactive as possible and having a wide network of individuals that are staying up to date on all that is very important.
Okay, great. And where would all of this information be compiled so that anybody can kind of use it at any point?
Yeah, so we have Dropbox, and we have different things internally that we save all the documents. We also do training. Another regulation that I didn't mention that I should have is HIPAA, so being HIPAA compliant. So we have annual trainings, we have quarterly trainings. If there's any changes to any of these guidelines, then we will send that out to the team, and then people have to take tests and quizzes and to stay up to date.
Okay. So that's all the different ways that you kind of make sure that each rep is kind of trained and up to date on each individual thing. What about making sure that every department within your company is aware of all these little things as somebody becomes aware of them?
Yeah, so we have different trainings. So like right now, we've made a big push for hiring. So that's part of the new hiring packets being trained. And then there's residual training that has to take place throughout the year. And so from a sales standpoint, as national sales director, that comes from ownership to me and then passed down to the reps. From a laboratory standpoint, we have our vice president of operations, our lab director, who is in charge of training all the staff within the laboratory, and she gets her information from the executive team, from the consultant that works remotely and in the lab. And so each department head gets given the information, and then it's passed down. And so we all sit in on all those meetings to see, what are changes, what's going on in the industry, and what we can do to get that information to our sales force and our employees as quick as possible.
Got it. So it's really important, obviously, that every department head, everybody at senior leadership is aware of everything so that everyone's on the same page. And a big focus of yours is making sure that there is that unity between sales and marketing. Tell me about how you make sure that there is that kind of cohesion between those two teams.
Yeah, so we have a great marketing team, and a lot of the things that I go to marketing about is from sales reps and our customers telling us what's important for them. And so, our company is built today based off the end user and the customer. And so our marketing team takes our needs and our wants and finds a way to make that come to life. And a lot of that is around regulation as well. And so it's important for us as we make these big pushes on social media and talk about our COVID testing, our mobile COVID testing, some of the proprietary technology we have around drug screening. We want to make sure that what we're saying is accurate, what we're saying is legal, what we're saying is ethical, and what we're saying is true. And so any marketing piece like that also goes through legal and through our consultants to make sure, because the last thing we want is to be misleading anyone or sending something out there that, if health department or CDC or someone's reading that, that it dots all the I's and crosses all the T's. So.
Got it. So it sounds like everybody within the whole company has to be very agile. Of course, the sales reps and senior leadership need to be agile because regulations are changing. They need to train people as these changes come up. But then marketing needs to be very agile to kind of respond to what's going on in the industry and support the salespeople with kind of content that will help them sell according to some new change.
Yeah, it's crucial because marketing's key to get the word out there of what we're doing, but accurate marketing is also important to put marketing, because marketing's also has to be thought-provoking, right? So you want it to catch someone's eye, and you want to put things out there that makes you different than the other competitors in the market, but you also need to be saying things that are true and things that are legal is also a big one. In a highly regulated market, people are looking at anything they can do to try to point out flaws or point out something that's not right. So.
Right. So that's kind of one of the unique challenges for you guys, is that everything that you want to put out has to run through legal first. Do you find that is something that slows things down? How do you make sure that you're not kind of spending downtime when you've got to check things through the legal team?
Yeah, so it is, legal, we always joke, it's like such a blessing and a curse. But to see these different, I've I've seen labs on a yearly basis get busted for doing things that aren't right. Or, when COVID testing first came out, all these people were saying, you know, drive up COVID testing, and there wasn't even medical professionals, and people were ordering tests off of uh, from China, and they're posting things on the radio, and all of a sudden health department goes by and shuts the whole thing down. And so, they cut corners to get out and try to make a quick buck. We were slower to market that we were doing the same type of testing, but we're a CLIA certified high complexity diagnostics laboratory, so it was legal, but it took us an extra couple weeks to make sure that everything was kosher. And so, we could have made extra revenue the 2 weeks before that, but we could have potentially not done everything right. So, it's a balance between not rushing, but also being quick enough to where you don't miss out on too much opportunity.
Absolutely. That makes sense. That's something that has kind of come up with other, some of the other salespeople and people I've been talking to in this series and this highly regulated series. It seems that in a highly regulated industry, buying cycles are always longer. There's more you've got to check. And it is this kind of case of, as you're saying, like slow and steady, because you want to make sure that you're doing everything by the book. You're proving that you're doing everything correctly. And if you are, then you get that sale in the end. But it does take a little bit longer. And also, generally speaking, highly regulated industries are a little bit more archaic, not in kind of a negative sense of the word, but in this kind of, it's more traditional, because these regulations seem to kind of hold everyone in this traditional space. There's not kind of a whole lot of ingenuity coming with the way that you can sell, because you absolutely have to adhere to these regulations. So it makes sense that putting kind of just forgetting that it's going to take a long time and kind of saying that's okay. If we're doing everything right, we're going to get that sale. It's going to be a long-term customer. It's going to be a repeat customer. We're going to maintain our reputation, and that's fine. Better than as you're saying, getting those 2 weeks of potential revenue, but maybe doing something wrong and then spoiling the reputation for good.
Yeah, and you know what? The more tenured we become as a laboratory, first of all, our executive management team has really been in the lab industry since about 2010, and so we're not new at this, and the lab staff's been there a long time. But for a new company, there's changes, but you learn, right? You learn how long some things take. You learn how long, generally a marketing piece takes. You learn how long it'll take to get approved by legal. And so being proactive and starting that process ahead of time, then all of a sudden it's not an issue when you know that you want to launch a product, or do a big marketing blitz in September 1st. All right, well, we have a whole month to prep for it. So preparation's huge.
Makes sense. So how would you kind of filter out what you actually want to focus on for marketing, for instance? So say there's some change that happens in the industry, you can kind of see it coming, but I'm sure there's a lot of changes going on at all times. So how do you pick the ones that you are going to set out that month-long plan to put through legal and get some content out there?
Yeah, so it's balancing between, we get phone calls all the time. A lot of times it's reps saying, I really need this. And I'm like, yeah, and so, you want to respect your rep and show that you're there to support them, but that's one rep in one specific territory. And so what we usually do is we have a running board in the office, a huge whiteboard, and we'll write down new ideas. And then when we see the same idea happen a couple times, then we start reaching out to customers. So when we redesign requisition forms, we have our new rec form is incredible, because we took it to a handful of our top customers and said, in their staff said, if you could design a perfect rec form, what would it look like? Our company came to be today with some proprietary technology that we felt was needed in the industry. And so we worked with customers to help design that. And so taking needs that we think is important, but bringing it to the customer, because we've seen time after time companies that invest all this money into, if it's marketing or testing or equipment or something like that, and then they launch it out of the industry, and the customers are like, it's not really a big issue for me, or yeah, I really like it, the way it was before. And so taking the customer into it is important. And so that's kind of what we've done across the board. And we'll let the customer filter out what's important and not important. And a lot of times it's not necessarily what we thought, but we're the peanut gallery.
That's so interesting. I recently did an episode of this podcast with somebody who had worked in like software products. And it's funny because it seems that there's almost the opposite problem with that. With if you're building a software product and you're kind of in constant communication with your early adopters, these customers, they have a lot of ideas for these kind of new features that they want built out. And so instead you're trying to weed out what the customer wants and think like, is that actually something that's going to be useful for other customers or whatever down the road? And it seems that in your case, it's sort of the opposite, where maybe what you're asking from marketing is something that a rep wants, when in reality, you've got to turn around and speak to the customer base and see what they want.
Yeah, I think it's a mix between everything, because I will tell you that some of the things the reps want, I'm like, that's never going to happen. And then there are some times that a doctor asks for something that's just astronomical, and everything comes at a price. We use what's called a LIS. It's a laboratory information system. And so doctors always want to change different things with the reports, and each one of those costs $1,000, $2,000, $5,000
Right.
to do. And so it's a way of taking really what the most important things are, find out what's best for the customer, what's best for our employees, and finding a happy medium. And we've been able to do that so far. And so, but I'm not saying that we're never going to disappoint some people, but there's an eloquent way of doing that, where hopefully you have so many other positive things going on, where if you can't do everything for the customer, they're 98% bought in, and so we can deal with the 2% of the time that maybe they're not thrilled about something.
Yeah. Okay. Makes sense. Makes sense. Okay. Let's talk about how you use all of the research that you guys do, because you put a lot of effort into that, into keeping your reps up to date. How do you use that research to generate new opportunities, say to kind of spark new conversations? Do you use any of the stuff you learn as like a trigger for cold outreach, or what do you do there?
Yeah, absolutely. Being a resource is huge, and that's something that I've always put a lot of pride in as a rep. And so, no one wants someone just to market dump on them, right? And then just start just throwing up everything about their product. And so you need to show that you're a resource. So your product may allow you to be a resource, right? Maybe you have quick turnaround time, or maybe that, if you're selling a commodity, your price is a little bit lower. But what I've seen to be the best is to really be a resource for your customer, especially in medical. And so we put a lot of emphasis on training our reps when they go in to be up to date with what the guidelines are for their state, or maybe for their specific county. And when they bring that in there to say, hey, doctor, let's take urine drug screening, for example. Here's the guidelines for the state of Florida on controlled substance monitoring. Here's what it says you need to do to be compliant with the state. So God forbid a patient overdose, or God forbid a patient get caught selling the drug that you're prescribing, and they come in, here's line 1, 2, 3, 4, 5 that you should do. And a lot of times they're shocked because they haven't seen that before, but they've been working with reps, and they've been working with my competitors for years. And so compiling data that's important for the end user and bringing that to their attention is really important. And so we're always checking the guidelines. They revise them sometimes a couple times a year. And so anytime that happens, it's important to bring that to the customer.
Absolutely. That's another thing that has come up time and time again in this regulated industry series, being, as another guest, Troy Angranon puts it, rather than being a seller or a vendor, you want to be a valued partner. And that's exactly what you're saying here. You're not just coming in and saying, here are the products I can provide you for X amount of money. You're saying, here's how I'm going to help you solve a problem that you have. Even if they don't decide to go with you, you've still provided value in that first conversation. So you're proving that you're an expert in your field, that you're up to date on that research, and not only on the research about kind of the industry, but something very specific to that doctor that you're reaching out to. It's, as you mentioned, you're kind of going, what specific regulations exist in that specific doctor's county with this type of testing that they might do. So being ultimately in the know about everything makes you be this value provider, as you're saying.
Yeah, and a lot of times, this is what I tell my reps, and it goes back to it. I'm like, listen, you're the expert on your product, right? And so a lot of times so let's say that you're in medical, you're meeting with a doctor, and people think like, oh my gosh, it's a doctor, like they know everything, right? Or maybe that you're, doing sales, and you're meeting with executives of companies, and you're like, man, this guy's executive vice president of the president. He knows everything. Like, that's not always the case. And so a lot of times they look to you to be that expert. And so you can never be over prepared. And so, especially when it goes around guidelines or testing guidelines or what's legal or what's ethical or what they need to be doing, if you can answer that right away, you instantly get credibility. If you can't answer that and you get the answer to them quick, they're going to know that you have good resources, but they may question you a little bit. And if you have absolutely no idea and you tell them you don't know, then that's red flag central, right? And so being able to be a resource with showing that you're up to date with what's going on in your industry instantly, sets people at ease and gives you a lot of credibility.
Yeah, that totally makes sense. If you think about a doctor or a VP, as you're saying, some executive, their kind of scope of everything within their responsibility is so wide, and you're coming in with expertise on one part of it. So it is possible that you know more than them in that one part, and that's fine. They're not going to be offended. They're not going to take offense to you kind of sharing something with them. It might be something really valuable. So that's a good point.
A lot of times they embrace it. It's the opposite. They're like, wow, this is great. Or they're like, so not only are you professional and you're nice and you're funny and right, but they're like, not only do I like this guy, but he's done more for my, for this portion of my office or my practice in the last 5 minutes than my rep's done for 3 years, because they bring donuts and they're fun and stuff. But, donuts make you fat and they don't necessarily protect your license and your practice. So
right. Yeah, makes sense.
I'm not hating on donuts. I'm a big donut guy. So
I'm a big donut fan too. You can do donuts and value.
That's right. Both of it.
Awesome. So in the kind of prospecting process or in the selling process, how do you instill confidence in the doctors that you are going to be compliant with all these regulations that they care about?
Yeah. So reputation's huge, right? And so number one, coming in there day one and being completely transparent. So there's a lot of my competitors that won't say, what they bill, how much they bill, what their billing policy is. A lot of times there's people out there that have no idea what's going on in the industry. So number one, being transparent. Number two, showing that you're that resource. Number three, always having a list of references if they want to call somebody. Being able to show at a drop of a hat if they ever want to know anything about our clinical licensing or our products or statistics about accuracy, then we can supply all that. So really feel like we're an open book and there's nothing that they ask us that we're going to beat around the bush or not give them a straightforward answer.
Makes sense. And so reputation is key, and it's been key with these other companies or people that I'm talking to. Something that other companies or other people in this series have mentioned is that in their highly regulated industry, it's kind of a small world. Like everybody kind of knows each other within these segments of a highly regulated industry. Is that true for these highly technical labs like you run?
Yeah, I mean, in a lot of ways, the laboratory has gotten a bad reputation. So you look at from anti-kickback to labs cutting corners to labs doing different like pass-through billing to labs getting sued for $500 million, $100 million, $1 million for fraudulent billing practices. I still run into doctors telling me that reps are offering them money for samples. I have nurses that tell me that their rep pays them this much money or gives them something, for them to run samples. And so you can, I forget what Warren Buffett says, something that can take you 20 years to build up your reputation and 20 seconds to lose it. So people know who some of the bad fish are in the industry. And so that's something, we always say there's not one customer, one practice that's worth losing our reputation or losing the momentum that we have. And so believe you me, there's plenty of times where I'm like, man, if I cut this corner, you start seeing those dollar bill signs, but it's not worth it. And so, we know we're doing things the right way and we know we're here for a long time. There's a lot of labs that came in here, made a lot of money, did some sketchy stuff, and they're gone. Maybe they get in trouble, maybe they don't. But, you need to really know who you're partnering with from a lab standpoint and from a rep standpoint.
Mm-hmm. Makes sense. Okay. For those listening like me who aren't very familiar with this industry and all these regulations, tell me why it's not okay for there to be a kickback. I understand like ethically it shouldn't be about the gift that you give somebody, but if that lab is still kind of adhering to not the kickback regulations, but every other regulation, why shouldn't they incentivize a doctor with a gift?
Yeah. So it used to not be regulated, right? And so I hear stories of these companies being like Wolf of Wall Street type things where people are going on cruises and they're going snow skiing and they're going on fishing trips. And then all of a sudden you have a medical professional making a medical decision, not based off the product, not based off um, anything around their true medical expertise. At that point, it's who spoiled me last, who took me on that trip, who took me fishing. And all of a sudden, you may be putting a hip in, or you may be putting something tube in the heart, or you may be putting in, maybe you're trusting drug screening, knowing that maybe the lab isn't giving the most accurate results, but that rep,
Mm,
took you snow skiing in Park City, so you got to use them. And so that's when they really put the kibosh on
okay.
that whole thing. And so I'm actually a fan of it because it's an even playing field. And, then you're truly going down to how are you as a salesperson and how is your company and your product. So,
Makes sense. So if a doctor were to take something based on a kickback, who would the kind of responsibility or the, what's the word, like the punishment fall on? Would it be the doctor or the lab? Who would be caught
it,
out there?
yeah, it could be all the above. And so the majority of time, there's usually two parties get in trouble because
Okay.
if a lab, well, it could be multiple people. It could be the lab, it could be the sales rep, and it could be the doctor or someone within the doctor. Because if you're given a gift, the giver is going to get in trouble. If you're knowingly accepting the gift, they're going to be in trouble. And if the company knows about it, then they're going to be in trouble. So, that's not something that they mess around with anymore across the board. So.
Makes sense. Another issue that you've come up against with some of the labs that you guys compete with is seeing other labs outsource their testing to a different lab. And you've mentioned that this is kind of one of the things that gives labs a bad reputation, and you've got to kind of fight against that actively. Tell us why, first of all, that's an issue, and then kind of how you mitigate that when you're talking to a doctor.
Yeah, well, so lab to lab agreements aren't uncommon and necessarily unethical, because sometimes, like right now, COVID testing, a lab may be to capacity, so they work with a partner lab. Maybe another lab offers a test that they don't, so they say our partner lab is this lab. Maybe it has to do with insurance for if insurance specifically will only, or a lab will only pay for Quest or LabCorp, then maybe you say, we'll send your Blue Cross Blue Shield, for example, insurances to this lab. When it becomes issue is when people are claiming certain labs or people are running the test, but someone else is actually running it and they're billing for it. That's when it really becomes an issue. So lab to lab agreements aren't bad, but if you're doing pass-through billing and different people are claiming that they're running the test and billing for it and they're really not, that's when it becomes a real big issue.
Okay, makes sense. Okay, awesome. So to kind of recap on all this stuff, ultimately, the most important piece is being an expert. And you're an expert when you do your research on all the regulations, you're up to date on your training, you're kind of attending these trade shows, conferences, you're looking at all the online kind of forums or channels where you find all this information. And then you're not only doing that as a rep, but as an organization as a whole, because you want your marketing to reflect this. You want all the teams to be on the same page. And then when you equip your reps with that information, they can be this value added partner, this expert to kind of come to that prospect, share stuff with them that they maybe didn't know. And then they view you guys as a great partner, which ultimately feeds into reputation, which is the other big key piece in selling into a highly regulated industry. Because it is a small world. If you slip up once, you're not necessarily going to get another chance. And it's not worth, as you said, losing kind of a small amount of money, or as Warren Buffett said, don't take the 20 years to build up that reputation and let it fall away in 20 seconds. So those seem to be the kind of big key elements that go into selling into a highly regulated industry like the healthcare industry. Do you think I'm missing anything there, Mac?
No, I think that you really hit the nail on the head, and it's you're going to face a lot of instances where you can take that quick corner, but it's not worth it. And you do your research, and type in lawsuits or labs closing or whatever industry you're in, you're going to find people that if you ask them now, they'll say it wasn't worth it.
Awesome. Well, thank you so much for coming on the show, Mac. It's been super interesting for me to learn about an industry that I don't know very much about. And it seems like there's quite a bit of like intrigue and drama with all the different ways that people can not adhere to the regulations. So it makes for an interesting episode for me, and I'm sure for our listeners. So yeah, thank you so much for coming on and sharing your expertise.
Thank you so much for having me.
If people want to get in touch with you, if they want to learn more from you, where can they do that?
Yeah, so I can send you my contact information, but my email is mckellar@nonascientific.com. And then on LinkedIn, we're also hiring. So we have some really neat proprietary technology around the urine drug screening. And we're also offering our whole new molecular division, including COVID-19 and different molecular panels. And so if you're a rep out there that is currently selling those or have relationships in pain management, treatment, addiction, I would love to talk to you and see if we could maybe work something out. And that's anywhere across the US.
Awesome. Well, there you go, guys. You maybe got a new job out of this episode.
That's right. Sarah, you're hired. Congratulations.
Yes. I don't know anything about healthcare, but I'm in.
Just pick up the donuts. You'll be good.
Yeah. I'll just get a pack on my snowshoes and offer to bring them up to Canada.
Oh my gosh. Yeah. We'll come down to Florida. You don't need snowshoes.
That's true. Okay. Awesome. Well, thanks again, Mac. And thanks for listening, you guys.
Thanks, Sarah. Thanks, everyone.